Hi, I'm Heath Morrison, founder of Sikkim. At Sikkim, we're developing a way to drastically increase transparency and reduce cost in the US healthcare system. It's no secret that the US has one of the most confusing and expensive healthcare systems in the world. It's become a bloated $3 trillion industry that thrives on the fact that patients are forced to pay whatever providers feel like charging them, leaving patients with a terrible but obvious choice: your money or your life. To make it worse, most providers only tell you how much you owe after you've already been treated. Can you think of any other industry that works this way? Imagine flying cross-country and then having to pay whatever the airline decides to charge you after you've landed. And the problems don't stop once you receive your bill. Most medical bills are a maze of codes, jargon, and abbreviations that make it very difficult to find extremely common overcharges and other accidental increases to the bill. A lot of folks are trying to help tackle these issues. And before I tell you about our approach, I'd like to tell you about the reason why I founded Sikkim. This is my granddad. He's the one on the right. His name was Wade Beale, and he was the best granddad anyone could hope for. He personified patience, kindness, wisdom, wit, intellect, honor, and compassion. I swear if you had known him, you would have loved him. At 84, Granddad was diagnosed with a condition called hydrocephalus. It caused dementia and a host of other terrible issues that made it necessary for my mom to move in with him. In the following years, he received dozens of medical bills. My mom had to sift through them all, and she discovered that they had billed him multiple times for the same procedure, for items that Medicare had already covered, for things that hadn't even been done. Keep in mind, they were sending these bills to someone that they had diagnosed with dementia. A man who had trouble telling dreams from reality some days. An honorable man who paid his debts and prided himself on doing so. Who would have bankrupted himself paying these people if my mom hadn't been there to stop him. Barely a day passes I don't think about my granddad, and about the fact that the deplorable billing practices he was subjected to are commonplace in a system that has forgotten the most basic tenet of the medical profession: do no harm. The power of the free market could help reduce many of these problems, and the US is a country where the free market supposedly reigns supreme. But there can be no free market without the ability to compare prices or an understanding of what we're buying for those prices. At Sikkim, we want to bring the free market to the healthcare industry. We're going to take the very bills that patients are sent and use them to expose the true cost of medical care by building a nationwide database that will allow people to search prices based on what others actually paid, rather than going on blind trust or vague estimation. We're also creating a way for patients to detect overcharges in their bills quickly and easily. We're not the first to think about building a database of medical costs. What we're developing is a way to check bills and compare costs in seconds, using a method so simple a first grader could do it. We'll be releasing more specifics soon, and we'll be launching a crowdfunding campaign that will allow supporters to gain early access to the service. Now you may be thinking, I'm perfectly healthy, and my company provides me with excellent health insurance. Why should I care about this project? Well, do you realize the premiums for that plan come out of your paycheck? Do you have a deductible or co-insurance payment? Do you believe in the power of the free market? Do you have a mother, a father, a grandma, a granddad? Are they getting older? Are you? If you answered yes to any of these questions, you care about Sikkim's mission. We don't believe your money or your life is an acceptable business model. We believe you deserve the chance to have as much as you can of both. Please join us. Thank you.